To me, women's health is significant because any aspect of women's health affects more than 50% of our population. I'm Asgi Fazleabas. I'm professor and associate chair for research in the Department of Obstetrics and Gynecology and Reproductive Biology, and the director for the Center of Women's Health Research at MSU College of Human Medicine. I came here when this was just all a dream. But the vision was that we were going to, with the movement of the medical school and the expansion of medical school Grand Rapids, the vision was women's health research would be a top priority area. It is focused on reproductive research. It relates primarily to infertility, gynecological cancers, and these diseases like endometriosis, fibroids, and how that affects their fertility, how that affects their future ability to have a family. In vitro fertilization or assisted reproductive therapy has been around now since 1978. Yet our biggest barrier, 75% of pregnancies are still lost before the embryo really attaches to the uterus. So that's a huge loss in an ability of women to get pregnant. As they get older, that gets even more pronounced. So trying to understand that fundamental biology as to what is it that creates this environment that's hospitable to a developing embryo is really very, very important. A lot of times when a woman comes in and she's diagnosed, she's had this disease for an extended period of time. So we really don't know when the disease began, how did it begin, what is the basic biology behind the disease. And many of our researchers are really interested in asking that fundamental question. And once we answer that fundamental question, that opens up avenues for diagnosis, for therapy, and a number of these other things that are absolutely essential and lagging behind because we just don't understand the basic biology of the disease. We are basically limited not by money, not by the commitment of the institution. We are simply limited by space. So having a new building not only is going to allow our scientists that we already have here to flourish, we're shooting high. We're trying to bring in people that are at the very top of the ladder. Being part of which I think now is probably the premier program in women's reproductive health and reproductive and developmental sciences. Now that's only going to grow because we've now been able to expand even further into maternal and infant health. I think I'm especially proud of building the program and what the future is. Being able to get really, really bright young people to come and believe in what we're doing here. There's no better place to be in the country right now than Michigan State University.